Good afternoon. My name is Sarah Weiner, Program Manager of Education and Practice at the Association of Schools and Programs of Public Health. Thank you for joining us for today's ASPPH Presents webinar, National Board of Public Health Examiners Certified in Public Health Exam New Content Outline. Today's webinar will be 1 hour in length. We will begin with a short introduction of our three presenters, followed by the presentation, and ending with a question and answer period. This webinar is part of the 2017 ASPPH Presents monthly series. The webinar is being recorded and it will be available on the ASPPH website in the archived webinar section soon. Additionally, this webinar has been approved for 1 hour of CPH continuing education credit. A few housekeeping items of note. While you are in listen-only mode and your lines have been muted, we encourage you to ask questions throughout the presentation by using the question box. We will address your questions at the end of the presentation. We are pleased to have with us today our speakers, Richard Kurz, Chair of the NBPHE Board, Jim Yeager, Chair of the NBPHE Testing Committee, and Allison Foster, President of NBPHE. Allison, I'm going to turn it over to you.
Okay, thank you, Sarah. So the main thing we're going to talk about today is the new CPH content outline. But first, I'd like to get you all caught up just on a few developments with the CPH before I turn it over to my colleagues, Rick and Jim. So we are continuing to make changes to the Certified in Public Health program so that we can continue to meet our goal of credentialing public health leaders and professionalizing the field of public health. Just as a reminder, the basic certification process is that candidates who wish to be certified in public health must meet our eligibility requirements. Then they must pass our CPH exam. And then once they pass and they are fully certified, then they must maintain their credential through a recertification process. So we've made a few changes to our eligibility requirements. So all graduates of CEPH accredited schools and programs are eligible to sit for the CPH exam, as are students, as long as they have taken or are concurrently enrolled in the core. And last year, we also added another path to eligibility for individuals who are working in public health who have at least 5 years public health work experience and at least a bachelor's degree. The exam itself is a timed exam. It's comprised of 200 questions, and all candidates have a 4-hour block to complete the exam. It is a multiple choice exam, single best answer, and one question we do get is how complex the questions are, and none of our questions require calculators or scratch paper. So a few changes that we made recently regarding testing is that we now offer the exam all year round, 12 months a year. Until recently, we offered the exam 3 months out of the year, and now it's available all year round. A new development that we've been seeing lately is that a number of schools and programs are requiring the CPH exam of all graduates. And this has been a quite interesting development as we see more and more come on board and really utilize the CPH exam. And every year we see another 1 or 2 schools and programs adopt requiring the CPH exam. And we also have a number of schools and programs that have a significant volume of their students who take the CPH exam, and we believe that they are encouraging their students to take the exam as well as the schools and programs that require it, because the exam results can be used towards CEPH accreditation requirements, but also it gives the schools and programs great tools to really assess their student performance compared to other schools and programs. And we also have a number of employers and organizations who are really certificates out to all candidates who successfully passed the exam. And we're going to continue to do so, but I believe very soon this summer, we're going to be offering digital certificates to those candidates as well. And so the digital certificates can be attached to LinkedIn profiles, email signatures, and it's really a way to share their certification status with others electronically. So we think this is going to be a really big benefit to CPH. Okay, so I hope you're as excited as we are about some of the new developments going on at the CPH, but the big one that we wanted to talk about today is our new content outline that we're going to be announcing very, very soon. So I'm going to turn this over to my colleague, Dr. Rick Kurz, and Jim Yeager to talk a bit more about the CPH content outline. Rick?
Thank you, Allison. That was great. It was a great introduction to where we are now and what we're doing and some of the advances that we're making. So we want to today talk a little bit about where we're going, and to start, just give you a little bit of an idea where we are now. In other words, the current exam. Current exam has several parts to it, if you like. Basically, the core areas that we're all familiar with, pretty much, of biostat, epi, environmental, health policy management, and social behavioral. Each of those areas has 30 questions on the exam. We also have a general principles area, which basically is fundamental concepts and some historical material, and it has 25 items on the exam. And then there are the cross-cutting areas, which folks in the academic realm are familiar with, that are listed here on the screen. And for that total group of cross-cutting areas, we have 25 items on the exam. So that comes together to be a 200 exam item format, which was just presented by Allison as well. So that's where we are now, but where are we going? Fundamentally, we have really, I would say, two motivations for what we're trying to do into the future. We really would like to improve the exam so that, first, it is a really sound representation of the knowledge and skills that are needed to perform public health activities in the varied work environments that we have for public health. That is, for those who pass the exam, they should be able to say that they can perform the tasks that are basically needed by mid and upper level professionals in the field. And as you will see, as you saw from the eligibility, and as you'll see what we're doing here, that's one of our goals, is to be sure that that is the case. A second motivation, and an important motivation for us, is we would like to have the Certified in Public Health program accredited. And there are two accrediting bodies that do accreditation in the area of certification. And the most appropriate for us is what is described here as the National Commission for Certifying Agencies, the NCCA. And one of their requirements that we don't fully meet now, but you'll see we're quickly moving towards, is that the exam be based on a job task analysis. And we have conducted one of those, as we'll describe it to you. And so we're bringing that into fruition now as the basis for our examination. And that will be our next goal, as you will hear. And we're very close to having that at least accomplished with regard to our content outline. What is a, and then go back here. Let's see, previous. There we go. For many of you may know what a job task analysis is, but some may not. So we have a slide here just giving you a basic description of what it is. The job task analysis is basically defined through a set of domains for a particular area, and then the tasks that are related to those domains. Certainly the necessary knowledge and skills should be the basis for setting up those tasks within those domains. We started with this, and you may, want to think in terms of an example, something like dental hygiene, which all of us, I guess, have gone to dental hygiene. So I've gone to more than one. They basically do the same thing. Their tasks are pretty obvious. We may not understand all of the details of those tasks, but we've seen them. And that's how they're certified, through those tasks that they are performing well. Where we have gone now is the creation of another set of domains for our tasks into the future as we create the job task analysis, or have created the job task analysis. What we did was we prepared a task force. That task force, a couple of activities that they needed to perform. The primary one was to set out a set of domains, and these are the domains represented on the screen here that we began with. They were conceptualized by the group as the domains that were needed to describe the task in the arena of public health. We then had to identify those tasks, which was a long and fairly detailed process, but we did that, took an extensive review, and we narrowed it down to basically 200 tasks that were going to go into the survey that we conducted. This slide summarizes that we did have a 200 task survey instrument, and in that instrument, the folks who answered it were asked to do two things. One, they were first asked, do you do this task at all? Do you ever do it? Never performed as we described it here, and if they didn't, they gave a 0 to that task. But then secondly, we asked them, if they did do that task, how important was that task to them? Was it not very important, very important, or essential? So that gave us a way of ranking the importance, the significance of that task, so that we could look at those tasks that were the most important or the most significant for individuals within public health. There it goes. Oops. Again, too far. Well, I'm not having much success getting back to that. There we go. What we had to do was to rate their current work with regard to these tasks. And the important thing here is that we did not ask them to say what they should do, or what they thought they should do, or what others should do. We didn't ask them to rate what other people they knew in the field were doing. We asked them to rate what they did in their work, and that's the essence of a job task analysis. We did that through sending out basically a snowball survey to a very large number of individuals, and what we got back was about 8,100 individuals who started the survey, about 7,500 who completed a good part of the survey, and then we got down to about 4,850 usable responses. That was quite a large number of responses and gave us a solid basis for what we wanted to do. I want to talk a little bit now about results. After we completed it, we wanted to do some basic analysis, and this is probably this slide the most basic of that analysis. Is a table showing the ratings of the domain across the database from the highest to the lowest. And so the domain that was rated the highest in terms of the scores, in other words, the most important, if you like, or essential scores were given to it, was ethics, and then critical and strategic analysis, and so forth, down this table, with the last item being biological and environmental applications. So this is how our respondents rated these items, and it gives you an idea within the field what they saw as the most important task. Now, in order to understand this a little better, we have another slide here for you that shows you a little bit better representation. Did it again. If you can go back, there we are. A little bit better understanding of what came out of this. We asked individuals to tell us about their employment level, whether they were clinical consultants, entry-level individuals, mid-level, or upper-level individuals. And as you can see, we color-coded the domains here. And the reason we color-coded them was to make it easier for you to see this slide. And what you can see is that generally the ratings are similar to what we had overall, but there are differences within the particular groupings. If you look at the entry to upper level, what you see, for instance, collaborating and partnering, there's a kind of stepwise upward in that progression across the entry to upper level individuals. If you look at diversity and cultural proficiency in terms of the importance to particular roles, there was a downward sort of progression. That, we have not tried to interpret that particularly at this point in time, but it gives you some idea that there were differences in the importance ratings that were given to these by individuals who were in different positions within the world of public health. The next slide here gives us a little bit more detailed view of this. These are the top 10 rated items that came out of our work here with the job task analysis. And it's got a lot of words there. You may not, be able to read all this, but let me tell you a little bit about, what it indicates. And that is that if you look at the parentheses under each of these items, it indicates the domain. And 6 of these items were in the critical and strategic analysis domain, 2 in the ethics domain, and 2 in the collaborating and partnering domain. And indeed, if you look at the ones in ethics, they actually relate to data use and data gathering. So there is a heavy emphasis in these most important tasks to what I think all of us would describe now as evidence-based public health. That clearly is where the field is in terms of the tasks that they see most important to their roles today in public health. So we feel like our work here has given us a very strong basis for moving forward with our exam. Just a couple of remarks here about things we did to try to improve the actual set of items we were going to use for our content outline from the exam or from the survey. We eliminated those tasks that 80% respondents rating them. We had some redundancy, not much, but we eliminated that. We reviewed some of the suggestions that we got. We asked folks for suggestions. Was there anything we left out? And we got some, suggestions that we tried to take into account. And then we eliminated the items that had a less than a 2.5 mean on our 1 to 4 scale. So we got down to now about 150 tasks that will be the basis for our, job task analysis result that will create the content outline that we will go forward with in the future. The next thing I wanted to just say a little bit about is the analysis itself and where we've taken it. As you can see, the work we've done so far, the domains that we used were the conceptual domains that were created by the task force that we created. We think they did an excellent job with that, gave us a sound basis for creating the tasks that we were going to use on the survey. But we also wanted to go a step further. We wanted to try to see what the conceptualization of the work was based empirically on what we found from the survey itself. And to do that, what we did was a factor analysis of the tasks. And in fact, for those of you familiar with that, what we did was a principal components analysis, actually a very basic analysis. And when we did it to try to maximize variance, we actually got 16 factors. And when we looked at those, some of them were too small to really be useful to us in creating the content outline. So we went back and forced a number of solutions, and the 10-factor solution really seemed to be the best. And it did explain ample variance, so we felt very confident in that. And these are the domains that we now are focusing on. This is the result of that content, the result of that principal components analysis. And we found that these 10 factors do a good job of representing what we have in the content outline now. And you will, in the next segment of what we're going to do, you'll hear more about what we're doing with these factors, how we use them in creating the content outline we're going to move forward with. So at this point, I'm going to stop and turn the program over to Jim Yeager, and he's going to tell you about how we're taking this information that we got through the factor analysis, and we are creating a content outline that will be the basis for our examination. Jim?
Okay. Thanks, Rick. That was a great summary of how we got to where we are right now. So again, these are the 10 domains that form the basis of the future exams content outline. And we'll go to the next slide. There we go. So one of the things that we did is look at how the content outline that we developed compared across with competencies and major areas that are developed by other organizations. And so you can see on the right-hand side is our 10 content our 10 domains from the job task analysis. And then looking over, you can see from the Public Health Accreditation Board, Standards and Measures, Council on Linkages, Competencies, ASTHO, ASPPH, Blue Ribbon Public Health Employers Advisory Board, and the Framing the Future NBPHE report, the major areas or competency areas that they had developed in separate processes. And you can see that there is a nice comparison across to the content outline that we've developed for the future National Board exam. So they're analytical assessment skills, kind of sit at the top of all of them, and as in our content, our domains, evidence-based approaches to public health. And so you can study this in greater detail because these slides will be available to you. So it made us feel good that we weren't out in left field. We were right in where with areas that others felt were really important skills or categories of skills that public health practitioners really need to have. The next slide shows a comparison with the recent ASPPH or CEPH, one slide too far there, CEPH foundational competency domains. That's shown in the left-hand side. The right-hand side is our content, our 10 content domains. And you can see that there's also a similarity here. The top one, evidence-based approaches to public health, and we have that as one of our domains. And so there's a lot of overlap with what CEPH developed for their foundational competency domains with the content outline domains for the future exam. Next slide. So one of the things that we have to do now is do a lot of item writing. And this next slide shows the number of tasks that have various items in the exam question database. So we refer to questions as items, and you can see that in our current situation is that we have 26 of the tasks that come from various domains where we do not have any items or any exam questions. And then you can see that over on the right-hand side, we have one task that has 114 items or questions in the database. And so obviously, in areas where the exam database for the items is very low, we have a lot of new questions that have to be written to represent the various tasks that are distributed across the different, the 10 domains. So Allison is going to be working to identify item writers and ask for help in developing these new items for use in the future exam. Next slide. So what is involved in test development? The development of the test is very detailed and thorough process. And so we do an item bank analysis, and that is new questions are the whole, like we just showed you, the whole item bank is analyzed, and here we did the analysis as to whether there are items that actually meet the new tasks that we've identified. Then for those individuals who are interested in writing new exam questions, then we have a training session for the volunteers, and then they are given item writing assignments. And the item writing assignments now that we'll be giving out are related to the tasks where we don't have sufficient numbers of items for use on the exam. Then there's an item review committee that goes through and meets and goes through every item or every exam question. And this is really a laborious task, because the committee meets, there are about 10 or 12 of us, and we read every item out loud along with its distractors and the correct answer. And sometimes we decide that the item is not appropriate, or we reword the item to make it more clear. Then there's a form review committee. So when items that have been approved for incorporation into exam, and an exam is developed, the exam is referred to as a form, then that exam, before it's ever used, is reviewed by another committee, and there's overlap between these committees, and every question on the form is again read out loud and reviewed for appropriateness to include on the exam. Then after the exam, we do a post-test analysis where several of us get together and we look at the results of the test, and excuse me, we decide, if there are questions where there were issues, that the top performance, for instance, the top performers on the test got it wrong. We look at that question and ask, well, why was that the case? Was there any ambiguity in the question? Or if there were a question where perhaps, a large percentage of the test takers answered it one way and a sufficiently large another way, then we look at the question and say, well, was that other answer also possible? And if it was, then we tend to give credit for both answers. And after we do all that, then the passing score is set. And again, the circle goes back to an item bank analysis and continues again for training of volunteers and writing new items, etc. So it's a very thorough process. Next. So the CPH exam test using the new content outline, we plan on introducing this in January of 2019. And this will, of course, be after all the schools and programs have to have sent to excuse me, CEPH, either that they've modified their curriculum to meet the new CEPH accreditation standards, which is due by December of 2018, and or are on their way to making these changes. And so a whole year after that, we're still going to be using the current exam content outline, but that will stop as of January 2019, and all tests that are given after that will involve the new content outline. So there are going to be resources available, new resources available based on the new content outline, and they'll be available in 2018. We'll, as we do now, we'll have sample exam questions. As is currently the case for the current form of the exam, we will have a new practice exam available for students. We will obviously be doing additional webinars, and study guides are being developed by ASPPH and APHA. Now, this new content outline is available on the National Board website. So it's kind of a soft release, and Allison can talk about what major announcements will be made and when they'll be made. One of the other things is that if you're interested in using the data of the job task analysis, we have the raw data. You can contact Allison, and then she can make the data available to you. So, Allison, do you want to have do you have any additional things you would like to say? Or Rick?
Sure. I think I'd just like to mention we are going to do an official announcement next week about the new content outline. You'll likely be hearing about this for some time as we make sure that the word is out and then folks feel prepared to take the exam under the new content outline. And if any of your organizations would ever like a webinar or an in-person presentation, we'd be very happy to talk to you about what the new content outline may look like and how you can learn more. So please just reach out to us at any time.
Great, thank you. Go ahead, sorry.
I was going to say, we're anxious to have any questions, so we're going back to you, Sarah.
Wonderful. Thank you, Rick, Jim, and Allison. That was wonderful and clear. And we do have a few questions. So I'm going to remind everyone before we get to them that they can ask their questions by submitting them through the question box. And so for the first question, what is the anticipated timeline for accrediting the CPH certification via NCCA?
Allison, do you want to comment?
Yeah, I can take that one. So we talk to the NCCA regularly to make sure that we are prepared to be accredited. But so we've actually reviewed all of their criteria and matched it up with what we're doing. And the one area where we don't meet the criteria is that our exam is not based on a job task analysis. So the very earliest we could apply for accreditation is after we've launched the new exam. So we'll likely get very serious about accreditation right after January 2019.
Great, thank you. This next question, a little bit of background. Recognizing that ASPPH and NBPHE primarily serve an American audience, this school or program educates their graduate students to work in public health anywhere in the world, and NBPHE is certifying individuals who intend to take leadership roles in their home country. How is NBPHE addressing this issue, which could include expanding exam eligibility to graduates of schools accredited by the European agency rather than CEPH?
Well, I would say that I've always had that as a concern. However, a couple of things might be said about that. One is, I don't know whether we've done this nationally, but I know at my own university we did a little assessment of the students who were international taking the exam, because we did require it with our students who were Americans. And what we found was it came out the same. There really was there was no difference. And in fact, if there was a difference, it was at a probably non-significant, tiny difference in favor of the international student. That was a surprise to us. Now that we are moving the exam to tasks, based on this job task analysis, those tasks will be common. They don't ask questions in terms of things that would necessarily be simply true in the United States. These are tasks that public health professionals should be performing in the United States, certainly, but around the world. And so the exam will be a very good reflection of the field, and should be something that individuals in Europe or Asia or Africa or wherever Latin America would, be able to take. And if they have the right background and knowledge, they will be able to pass, just as students are professionals in the United States can now take the exam, and many, many do pass it.
Great, thank you. And following up that, will the eligibility criteria for the exam remain the same with the new format?
It will for the moment, yes. We always are considering that, but we think we now opened it up as broadly as we really can at the moment. It takes into account students and graduates of the programs, but it also is open to all the professionals in the field who have a bachelor's degree, not a bachelor's degree in public health necessarily, a bachelor's degree, and who have that 5 years of relevant experience. We do review those things. The board reviews those things to make sure that individuals do have a relevant public health 5 years before they take the exam. And we do that for the benefit of the exam itself, but also for the benefit of the person, so that we're not telling someone that, yes, you can take the exam when we're reasonably sure that their background wouldn't really allow them to pass it. So we try to be careful with that, but that's where we are now. Obviously, I think at some point, somewhere down the road, we're going to get questions about the expanding undergraduate programs in public health, but we're not there yet, and I think the board is willing to stick with what we have as eligibility for the moment.
Thank you. The next question asked, is the test development process for the CPH similar to that done for other professional certification exams?
I'm sorry, could you say the question again?
Sure. Is the test development process for the CPH similar to that done for other professional certification exams?
Yes, I can answer that a little bit. Allison may want to jump in, or Jim also. It is. We work with an organization that has excellent experience in this area. The broad organization is called the PSI Institute, or PSI group, and within that there's another group that we began working with. They very expert in this area and have had a lot of experience with other exams. And so yes, we are operating fully as other organizations would operate. Allison, Jim, anything you want to add there?
Yeah, I don't have anything in particular to add, but I think the process is very similar. And Allison may have done a bit more research on this issue. So,
well,
you want to comment?
We've presented with CHES and actually had to coordinate our presentations because they were so similar when it comes to exam development.
Yeah, CHES was what I was thinking.
Yeah, there's very specific standards, and so I think that most credentials adhere to the same standards of test development.
Wonderful, thank you. One participant is asking if you could speak to the value of having the CPH certification along with an NBPHE with regard to job prospects.
Well, we would like to think that this, as a new, relatively new entity, the NBPHE and the exam, is moving towards providing a very strong basis for individuals, if they're graduate from schools and programs, or if they are not, to say, if they're school graduates, not only have I achieved my degree, met the competencies of my program within the school or program, I've achieved that, but I've also met a set of criteria based on an examination, and that exam now will be based on the tasks of professionals in the field. So I am ready to go as a professional when I enter the field. We're seeing, I think, more and more organizations looking to see whether individuals have a CPH, because it gives them one more criteria to say, well, this candidate is superior to that candidate. And we know that the schools all produce excellent folks, and people have excellent backgrounds from on-the-job training and that sort of thing. So this gives them one more way of looking at and evaluating in a very empirical, if you like, concrete kind of way, where the person is in terms of their knowledge and skills. Allison, Jim, you want to add anything there?
Yeah, my only comment is that you know, all of our schools and programs that are CEPH accredited obviously graduate many students each year. Lots of students, although we would like many more, do take the exam, and some fail. Even though they went through, you know, they may have gone through a very good program, they didn't master, and they graduated, they didn't achieve enough mastery to be able to pass the exam. And so I think the exam does, you know, provide a baseline and an assurance to employers, the potential employers, that the individuals that are applying for their jobs have a certain core level of knowledge, and in the new exam that it will be task-based.
Wonderful, thank you. And then this next question is actually from an item writer's perspective. This person is wondering whether there are plans to provide feedback to help item writers continue to improve their own skill level with regard to item writing.
Allison, you want to say a little bit about that?
Sure, I think that is a great question. As somebody who's been an item writer, I know you always want to know how your items do. So in some years when we have a lot of item writers, we actually assign the item writers a mentor who can work with the item writer along the way and provide real-time feedback. And the item writers also that have been engaged for several years, we try to invite them to our item writing meetings so that they can actually see in real time what happens to the items. So if there's an item writer out there that's really interested in learning more and really getting engaged, then just let us know, and we'll try to find a way, you know, to get you more involved with the item writing process beyond just submitting items.
It's an experience that is really quite informative, and actually, you know, personally, it's helped me develop, you know, when I write questions for exams in the classes I teach, the basic principles of writing a question, and, you know, and developing the distractors. You know, every question has 4 possibilities. 3 of them are distractors, and one of them is the correct answer. And so, you know, just how you develop these distractors, etc. It's really a very informative process. And so I think it is very worthwhile to have individuals, you know, interested in this to engage. You know, you can do it once or you can do it multiple times. So I think it's very worthwhile.
I would second that. I have 40 years in the field. I think none of us really got a lot of training in this usually when we were going through graduate education or even after that. And it's a, you know, I have learned a great deal about writing good questions from this process, and we do try to make sure that we're, you know, giving enough feedback to writers so that they are improving. And I think just being a part of the process and getting that feedback, it will improve your item writing ability. It certainly did mine.
Wonderful, thank you. And it looks like we have maybe one more question, and this was an easy one. After you take the test, are you informed immediately of whether you've passed or failed the exam, or do you have to? Is there a wait period?
You're now informed immediately after you take the exam. That was not true before, but we have now altered our process as we've gotten better at all of this, and so now you are told immediately after you complete the exam whether you've passed the exam. You don't have to wait. It was a waiting period of up to, I think, about a month, wasn't it, Allison? Maybe 6 weeks, but now that's not the case anymore. Anything you want to add to that?
Wonderful.
No. Well, one thing I'd like to do is go back to the 2 questions before, where the one person asked, well, what's the value of taking the exam if I'm getting an MPH from a accredited school or program? An additional factor is that there is a growing number of agencies that are putting in their job descriptions when they're recruiting new people CEPH certified is an important element of the application. And so, so as this grows, and especially I think it will grow once the exam is based on the job task analysis, it can give somebody looking for a job a little bit of an advantage over an individual who is not CPH certified.
Wonderful. And one other question did come in. If you could say a little bit more about the question review process after the exam is given. There's just some clarity requested regarding how you can be informed of your pass-fail status when the test has yet to be reviewed.
Well, basically there are, go ahead.
No, go ahead.
Basically, you want to go, Jim, or?
No, you can go ahead. I'll let you answer the question.
As we set up these exams, and they do have formats to them, we compile information as to the particular exam and its characteristics, and there are psychometric characteristics that go along with each one of the exams and the forms of the exams, and we know that. And so we can set the passing score for the exam. We know what that is to some degree going in based on our past knowledge. And the process that Jim described in detail is kind of the, you know, the first round of the process, if you like. If you didn't have anything and you went through it, here's what you would get. Well, we've been doing this exam. We have more than one form for the exam each year, but we have information and data on each one of those. So we do know, and we do actually, there are actually questions in the exam that carry over from year to year that help us to identify, you know, how we're doing on that particular exam relative to past exams. So we are able, based on all that kind of information, the psychometric information, if you like, to identify what the score should, a passing score should be. We still, you know, go back and look at questions, and there may be a case here or there where we have to make a change, but that's not typical. We have gone through such an extensive process of reviewing those questions. It just is not something that happens at all frequently. Jim explained it because it is something we do, but it's not typical of the result, and it's not typical of what happens.
Yeah, and in any one exam, there could be one question or two at the most where we really take a look at it and say we might want to make an alteration with regard to that particular question, but that would not have an overall effect on the passing exam score.
Yeah, and it's seldom that would change the score of an individual so they would pass or fail, that they were right at the margin.
Right.
That I don't know that has ever happened, frankly. I can't remember that has ever happened. It is something we do just to be cautious, but we generally know based on our past analysis what that score is, and we're then therefore able to tell a person whether they passed or failed.
Wonderful. Well, thank you for providing that clarity, and seeing as how I think we've all addressed all the questions that came in thus far. I want to thank all the participants who joined the webinar today, and thank you once again to our presenters, Rick, Jim, and Allison. And I'm just going to do a few closing slides. As a reminder, this webinar has been recorded and will be made available on the ASPPH website and the archived webinar section soon on the same event page that you visited probably to register. And I just want to let everyone know that we also have a few other webinars coming up, and you can visit our events page to see all webinars that are planned for the rest of the summer, and you can find out more and register. And lastly, we do have an undergraduate faculty development workshop taking place on Monday, June 5th at ASPPH headquarters in Washington, D.C. And we do have some openings, open registration spots still available. Thank you very much and have a wonderful rest of your day.
Okay, thank you, everybody.
Thank you.